Welcome back. Do your children play tackle football? Are you worried about concussions or any other health-related issues? Well, here is pediatrician Dr. Gabriela Ferder with the information you need to know. Dr. Ferder, it's great to meet you and great to have you on the show. How are you?
I'm fine, thank you very much.
So we're going to talk about one of my favorite things is football, but some serious sort of potential health ramifications of football. And I want to start with this. The nation's largest youth football program, Pop Warner, saw a participation drop 9.5% between 2010 and 2012. And one of the reasons why experts think that's happening is because of parents are fearing that their kids are going to have concussions. Okay, so we're going to talk about that as well as other injuries regarding youth football. But let's start with concussions. And how much of a danger is it, do you think, medically, for a child to play tackle football, and sustain some sort of head trauma?
Well, tackle football is definitely an aggressive sport, so there's a high risk, involved in that. But there's always ways to make the risk minimum. So as long as the parents know who the coaches are, make sure the kids are wearing the correct equipment, and the equipment is fitting fine for them,
right.
And it's well maintained, as long as the parents know that the field where they are playing is well maintained as well, it's kind of flat and nice and not very slippery. Those are all ways to prevent concussions, And a very important thing for the parents to know is that the brain of the kids are developing, so there's no fine concussion. All concussions are serious, and they need to stop playing, and they need to make sure they are fine and have medical advice before having them back to play.
So if a child gets a concussion, I don't know how you quantify this, but there are long-term ramifications of even just one concussion for a child, right?
Definitely. All concussions are serious, and the most important thing is to evaluate the kid, The kid may have no symptoms at the beginning, but it can have symptoms even days after, So the most important thing when you have a concussion is to come out from the game, And then there are many ways to evaluate the kids. The problem is that sometimes the kids don't want to tell that they are having symptoms because they want to go back to play, So the number one thing is that they never go back to play, Number two, you evaluate them. The concussion can make them to be dizzy, to vomit, headaches, heart problems in concentrating. They can have trouble walking with the balance, or they can look perfectly fine. But when you start asking them a couple questions, or you ask them to count from 10 to 1, they can start having issues there. So then you know.
So let me ask you this then, because in the NFL they have medical doctors on the sidelines that if someone gets hit in the head, they do all those things that you just said, right? But in a youth game, there may not be a doctor on the sideline. So as a parent, you see your child get hit in the head, maybe they come off their little woozy. What do you do? What do you do to make sure your child's all right?
Okay, if the kid is fine and is responding well, you take them out of the game and you give them a little bit of time to find out how they are doing,
Right.
Definitely they are not going back to play, because the problem is that when you go back to play, they are at higher risk of having a second concussion, and that can be very dangerous and even from to death. So they really need to stay away from the game. If they are having vomiting, if they are having trouble talking, trouble with the balance, or they are having a severe headache, they need to rush to the hospital. And every single team should have an emergency plan.
Right.
The coach needs to have an emergency plan, and they need to take them to the hospital.
So I think the most important thing is don't take it lightly.
No, never.
Yeah.
There's always, they always need to see a doctor and to make sure they are fine.
When I was a kid, I was telling you this before we started, we used to all play tackle football in the street without equipment or anything like that. I'm guessing you don't think that's a good idea.
No, not at all. Definitely, when you have a head concussion, it's not always straight blows to your head. It can be to your helmet, it can be to your shoulders, it can be to your neck. The problem is that when you play this kind of sports, you are having minimum concussions over and over and over. So if you can minimize those, that's a good idea.
Yeah. So in addition to head trauma, there are, look, football, as you said, is a contact game, right? So there's a lot of other things that potentially could happen.
Definitely. The concussion is, I think, what worries the parents the most, because it's really scary. And plus, if you have a lot of them, you can have even long-term problems. But there's also ankle problems. You can have an ankle sprain, you can have knee issues, you can have eye problems, you can have injuries to your elbows, to your shoulders. You can have, many other, fingers. It's a very common one that we see in the office a lot. Okay.
I'm only smiling because this sounds like no child should ever play football again in
No.
the history of time.
Every sport has a risk, okay? Like every sport involves a risk in it. So we need to know that sports are fun. Sports are good for your fitness. Sports are good for your self-esteem, okay? So, we encourage kids to play football. They learn very nice skills that they can then use in the field and also in the regular life. But definitely they need to play it in a smart way. They need to, get the equipment that prevents them to have an injury, okay? And they need to know when to stop playing and when to go to their doctors to make sure they are fine and they can go back to play.
So we're not suggesting a world where every kid just plays golf, because nobody wants to live in that
Not golf,
world.
but if I have to say, I would like my son to swim rather than to play tackle football.
Yeah.
Anyways, tackle football, it's a fine sport as long as they play it responsible and in a...
So as a pediatrician, I would imagine you probably see, I think kids can be out of shape like from an early age, right? Like, childhood obesity and things like that.
Definitely.
Yeah. So whether it's football or another sport, as a doctor, why is it so important for kids to play something and to be in shape?
Okay. Cardiovascular disease, like the problems in the heart, starts when we are really young. In the past, we used to think that that's an elderly disease, and because you have the heart attack when you are 80, you think that then is when you get the disease. But it's not true. Actually, since you are in your mom's thumb, you are getting all your mom's diet and all these different foods and fats and stuff that in the long term, okay, might eventually give you the cardiovascular problems and block your arteries and get you to have the heart attack, the stroke, and all those things that we see when we are old. But those things build up very slowly, are silent killers since you are very young.
Yeah, well, listen, this was terrific. If we had more time, we could probably talk for another 20 minutes, but you know what that means. You have to come back.
Okay, I can do that.
You sure? You thought about it for a second. I guess, if I have nothing to do.
No, there are so many important things to talk about.
Yeah, for sure. Thank you so much. And if people want to come see you, come visit your practice, call you, email you, Facebook you, whatever, website you, what's the best way to do it?
The best way to contact me is I work in Boca Raton for Pediatrics Associates, okay? So they can call our office and reach me there.
And reach you there. All right, thanks so much for coming in. Happy
You're
holidays.
very welcome. Happy holidays for you too.
Okay.
Thank you.
Thank you, Dr. Ferder, and that'll do it for our show today. If you have any questions as to what we should cover, all you have to do is tweet us at WSFL, or you can follow us at Facebook at SFLCW and on Inside South Florida. And of course, we will see you every weekday morning from 6 to 8 a.m. on Eye Opener right here on SFL TV, and we'll see you right back here, same time, same place, next weekend for Inside South Florida. You got all that? Good. We'll see you soon.